Good morning, everyone. Welcome to the Ohio Suicide Prevention Foundation's Voices for Suicide Prevention Advocacy Update. I'm going to be your host today. I'm Emily Steinberg, our communications coordinator here at OSPF. We're going to have some time after the presentation today to answer some questions, so please feel free to use the Q&A feature to submit those. Today, we are joined by OSPF CEO Tony Coder and Daniel Bettit, OSPF's Chief Strategy Officer. Gentlemen, feel free to take it away whenever you're ready.
All right, good morning. We are going to start off with an update on a proposed rule, the Uniform Guidance Rule, and this is related to the legal framework that governs federal grants and how they are administered. And this is a little bit of an update. The public commenting session for this actually ended yesterday, but we wanted to make sure that folks were aware of it. And I actually saw quite a bit of information about it being shared out on social media over the last couple weeks, and especially pretty heavily yesterday. But under this proposed rule change, some of the things that we could see happen would be that political appointees would replace peer review when it came to approving grants. So instead of potentially folks who were already in the field and maybe knowledgeable about the science behind a grant that's being studied, or maybe in our space, somebody who's knowledgeable about substance abuse or suicide, then it would be people who were appointed by the administration at any given point, who would review those grants and decide which ones were worth funding and which ones weren't. Another piece of this that I think, especially in the nonprofit world, would be potentially harmful or very scary to get engaged with is that a grant could be canceled at any time for any reason. So if you think about federal grants, if you were to hire staff or you are entering into a contract with somebody to provide a training with you or to do outside evaluation for a project you're working on, and you've got those contracts in place, the funding that you're working with could be canceled at any time, and then you would have to work through with those contractors on what that might look like, and if there were potentially penalties, you may still owe them that money. So the thought of engaging in projects and engaging in this work, knowing that the grant could be canceled anytime, is a really scary prospect, I think, especially in the space that a lot of us are working in. All research must be designed around administrative priorities. So whatever administration is in at the federal level would get to decide what priorities the grants would be around. And if something like, let's say, suicide prevention isn't an administrative priority, then they could just choose to not fund any grants in that space. And as we mentioned, the public comments had ended for this. When I had checked it last night, just before the public commenting period ended, there were a little over 290,000 approved comments. So the process, sort of how it works, is you submit your comment and then it gets reviewed to make sure that there's not anything in there that's potentially threatening or violent or anything. They make sure that the comments are related to the proposed rule changes. And then once they've gone through that process, then they are submitted and they're public comments. Anyone can see them. You can submit anonymously, but you can also have your name or agency tied to those. And again, about 290,000 last night when I checked it. Potentially, when it's all said and done, will be a little bit higher there. Another thing to know about this would impact every grant across all the federal government. So it's not just grants for maybe the health department or from SAMHSA. It's literally any agency that would give out a grant. This rule change would impact that.
Thanks, Daniel. Yeah, that's a really concerning that rule. We will continue to be talking to our federal legislators, as well as administration officials, and working with some other partners around the country to try to make as much impact on that as possible. If you have any questions or anything, please feel free to reach out to Daniel or myself, and we will try to help you as best as possible. I'm not an expert in the federal rulemaking process, but we can usually get you answers through the folks we work with at the federal level. Some legislative updates. So COSA, which we've talked about, the Kids Online Safety Act, which is around social media, has actually been combined with a number of other bills. I think it's 12 bills altogether have been combined to form what's called the Kids Act that recently passed the House 267 to 117. This is bipartisan. So there were both Republicans and Democrats that voted to pass this. This has not been passed by the Senate. So that is another process that we're literally doing. We have a meeting later today on it with some of our national partners on how to best work with this on the Senate side. Some of the things that are in this is social media rules. The platforms must offer minors child safety settings. Who can message a minor, limits on scrolling, rewards, all of this kind of stuff. And blocking, you can also block a minor's profile from being suggested to non-minors. The issue, we so in legislation, we have to remember we're not going to get, this is a marathon and not a sprint. This is something that we need to literally, with all legislation, you have to consider the politics. Baby steps need to be taken sometimes. Are these social media rules something that we're, excited about? No, because it leaves too much into the uh, ability for kids to control what they're seeing, who can contact them, that kind of stuff. Um, that's not optimum for what we wanted, but it is something another tool that we can tell young people about, and hopefully in the next Congress we can work with Congress on improving those measures. If we don't take action, then what happens is we are literally at status quo, which we know is not the best thing for everybody, for anybody, quite frankly. So there's a lot of these things that we support overall the Kids Act, but hoping that in over the next decade that we can literally get something passed that would be more effective. But again, this is a marathon and not a sprint. Um, there would also be advertising restrictions that ads aimed at minors must be clearly labeled. There'd be no ability to advertise narcotics, tobacco, marijuana, cannabis, marijuana, alcohol, or gambling. Those would all be banned. Again, we're supportive of those. Next slide, please. Platforms must provide a way to report harm to minors and respond within 10 days. So if this puts some burden on the on Meta, Google, and some of the other social media companies, that we do support that there have to be some kind of response within 10 days. Also, COPA, which is the Children's Online Privacy Protection Act. This hasn't been changed since I think 97. So the privacy around young people and what's shared between platforms and all the privacy issues, this would help to rein that in somewhat. There is you have to have consent from a user 14 to 17 before collecting and disclosing data. Again, it's another thing that we would probably have to educate young people about. And then there's also, which we which we did support COPA and this. Um, the language right now actually says that the social media platform has to have an actual knowledge, and this changes it to a known or should have known, which is an easier bar for us, for folks to prove that it gives more responsibility toward a social media platform to protect kids and protect their data, as opposed to having actual knowledge, which can be denied, just about any time. There's also a data broker registry, which brokers who knowingly sell a minor's data must register annually and pay $22,500 fee, which is not much, but again, it's a marathon and not a sprint. So how can we improve that the next Congress, or when changes are made, every 4 to 8 years at the federal level? AI chatbots are also included to that. Providers must disclose to a minor that they're talking to an AI, and this would also help that the bot cannot pose as a licensed professional, and must offer crisis line resources. This is one of the main reasons that we are supporting this. Again, this is far from perfect. This is far from what we would think be a perfect piece of legislation. But again, let's move. Let's actually get some baby steps, um, as opposed to just letting this, letting status quo. That's not working. We know. So we hope that there will be some restrictions around some of this online gaming, um, online pornography. Sites where more than one-third of content is harmful to minors must adopt age verification and block minors from under 18. Um, Sites cannot rely on self attestation. From what I understand, um, these sites are just kind of a "Hey, are you 18?" Type of thing. It's almost like an alcohol site. Give me your date of birth, and it's pretty easy to figure out that you can visit those websites simply by sharing that your birthday is in whatever date that's older than 21. Um, Preemption, it has been narrowed. This bill would preempt state and local laws to the extent they directly conflict with its standards. So states do remain free to pass stronger protections, which is the biggest part of the biggest argument between Republicans and Democrats at the federal level. And then enforcement. The Federal Trade Commission enforces as an unfair, deceptive practice. States, DC territories, and tribes can also take civil actions. So this would allow states, territories, and tribes to sue and give the ability to have some kind of civil suits brought against these companies. What it does leave out, you can the little green box at the top. What it leaves out is a duty of care provision. This bill explicitly states it can't be read to impose one deliberate, which is a deliberate difference from the Senate's COSA, and this is where the big hangup will be in the Senate. So that is something we are again we're working with Congress and the Senate to see if we can hopefully get this passed and get this to the president's desk for his signature um, by quite November, and we will give you updates on that. Huge, huge, huge piece of legislation, and again, not perfect in any way, but a little bit of movement, which is better than what we have right now. Next slide.
Hang on, I'm having some technical issues.
All right, you're okay.
Okay, there we go. Sorry about that.
And I wanted to take a look, kind of a deep dive, as we've started these legislative advocacy conversations over the last 6 months. We want to take a look at kind of the topics we've covered and the number of bills that we've engaged on. And at the state level so far in 2026, closing out the 26 fiscal year, we covered 14 bills in these webinars. Three of those were on the Senate side and 11 were on the House side. Senate Bill 273, the firearms retailer bill that we covered pretty extensively, that did pass and it's been signed into law by the governor. And then House Bill 718 was reported to the full House, but there's not been a vote on that one yet. Outside of that, Tony and I have had 13 legislative meetings in response to the 14 bills we've covered. Two of those were bills that we were in opposition of as an agency, and then the remaining 11 were either bills we were interested parties or in favor of their passage. And kind of, I thought very interesting some of the themes that we took a look at. Tech was high on the list. Four of the bills we talked about were related to tech, specifically around AI. Four in access to care through things like insurance access, like we talked about with PANS and PANDAS, and then also making sure that care was available in different parts of the state. Some equity there, like things that we talked about with access to telehealth. And then we did speak on the two bills or cover the two bills on firearms, again, with Senate Bill 273 being passed into law. And then on the federal level, coincidentally enough, we also covered 14 bills this time, but five for the Senate, nine on the House side. We had Senate Bill 836 pass the Senate side, and then House Resolution 7757 and 1041 pass the House side. 7757 is the Kids Act that we just talked about, and then 1041 is the bill for protecting veterans' access to firearms. It's the Second Amendment Protection Act for veterans. And that one was really, we were asked to weigh in on that one because there was some concern it might increase risk for suicide for our veterans, but it seemed like it just kind of put some reporting things on par as what the general population experiences. And then House Resolution 6484, that was COSA. That became part of the Kids Act. And so that moved forward with that on the House side as well. We did meet with legislators on six bills. That included COSA and COBA in both sides for the House and for the Senate side, as well as a couple others. And then our themes here, again, tech, very heavy. We saw a lot of that this most recent fiscal year with nine. A couple bills on suicide prevention, and then again, that firearms and veterans bill that we covered as well. So I really interesting to me to see where suicide prevention overlaps into a lot of these categories and how things that are being talked about every day on the federal side and on the state side may impact the work that all of us are doing across the state. It's been, I think, a really rewarding experience to see some of these things move forward as we've talked about them. We also wanted to share that we've got an upcoming meeting with Representative Andrea White. We had reached out through one of our webinars a couple months ago and asked for folks to give us some suggestions and some information on how they want the state and our partners to be advocating for prevention. And we've had some conversations within that space with our kind of our sister agencies, the Prevention Action Alliance, Prevention First, and then the Problem Gambling Network of Ohio. And so later this month, Tony and representatives from PAA and Prevention First are going to be meeting with Representative White to kind of talk about some of those priority areas for prevention and the importance of continuing to support and really put prevention out there at the forefront and really fund these initiatives for us across the state as we look towards this election year coming up, and we'll have a new governor, and we'll have, I'm sure with a new governor will come new priorities around what's getting funded. So it's really important we continue to have these conversations about the importance of prevention. I did want to share, as I mentioned, that we did ask for folks a couple months ago to share some comments on some of the things that stuck out to them that we should be advocating for when it was in the prevention space. And I just wanted to cover a couple of those items that came up. One of the things that we saw quite a few comments about were on cost savings and making that case to legislators that prevention in the long run actually saves more money than it ends up costing the state to provide this programming. And I highlighted one of the comments specifically I wanted to share today. Somebody wrote cost comparison, 1 hour of prevention education versus 1 hour of therapy. Cost associated with youth detention and mental health placement. Prevention educators are trained, credentialed professionals who deliver evidence-based information. And I've always heard that comparison when we say prevention's cheaper than treatment, or we probably heard an ounce of prevention saves a pound of treatment, or whatever that saying might look like. But when I really thought about what it costs for 1 hour of a QPR training versus 1 hour of emergency care for someone who's made a suicide attempt, or 1 hour of therapy for somebody who's living with a behavioral health condition that maybe if we'd have been able to get to them sooner, we could have prevented that level of care being needed. That one really stood out to me, to just that one-on-one comparison of an hour of prevention where we can serve 10, 20, 30 plus people at once versus that 1 hour of treatment where you're probably in a one-on-one space, and it's going to be significantly more expensive. And I know all of us support treatment, and all of us are engaged in that space, and none of us are saying that those resources aren't important. But it's just important for us, again, to put in that perspective that when we deliver prevention services in a correct way to fidelity, we actually open up those therapy services and those treatment services for the folks who really need them in the moment. We don't overtax the system, and prevention really does end up saving in the long run. Tony, did you have something to add?
Yeah, just we're meeting with Representative Andrea White because she's the chair of the Children and Human Services Committee in the Ohio House. And I really quickly wanted to make a point that this meeting, we should have done a survey, but I just literally thought of it, and things rush in and out of my head all the time. But this meeting, is this advocacy or is this the lobby? We're meeting Representative White at the State House in her office. Is this advocacy or lobby? Well, I hope that we would know that this is actually advocacy. We're absolutely allowed to educate a representative at the State House in his or her office every day of the week if we want to, or in the district or wherever. That just because we're talking to a legislator does not mean that we're lobbying. If we were taking a bill idea, if we, well, not an idea, an actual, if we were asking her to vote one way or the other, talking about our own support or non-support of a piece of legislation, that is lobbying. What we're doing here is absolutely advocacy every day of the week, because it literally is educating, in this case, members of the General Assembly about what prevention is, and the need for the entire continuum of care, and not just certain pieces that are, that are more thought of in the continuum. So I really want to drive this point home, that this is totally advocacy, even though it's with a representative, even though it's in the State House. We're not pushing for any piece of legislation. We're not pushing for any type of vote or anything else. This is literally giving information. So as you go out into your community, understand that literal education is what advocacy means. And just because it's with the legislator and you're educating them on prevention or whatever, treatment or whatever else, that's okay, and that we have to start accepting. Yeah, don't do, uh, make sure that it's with any kind of unrestricted dollars, but it's also okay to talk to legislators and educate them on everything that they should know about. So wanted to make that point quickly. Um, and then finally, just as a very quick thank you for what you do. In the last couple of weeks, we've received a couple of phone calls from individuals who have seen a 988 sticker or have actually asked for help in different ways. And both of them, both of some of these types of phone calls have been because they thanked us for lives being saved. So the advocacy that you do every time you stick a 988 sticker out there, you share at a fair, you share at a, whatever event you might be at, those have possibilities of saving lives. We don't know who we're reaching. And it really does come back to the point of, even though this job is hard and that we can think we're not doing anything, or like, oh my gosh, the numbers are bad or whatever, that we are making a difference. We are saving lives. Um, and I just want to thank you for everything you're doing in the community to help advocate for better systems and better care for folks who might be struggling and those who might need us in the future. So wanted to say that very quickly and then open it up for any questions or anything that folks might have.
Yes, we just got a question in. They asked, what can we share with our representatives about suicide prevention or any current bills?
Uh,
So,
Go ahead.
oh, sure. So you can always share to be considered advocacy and not lobbying. You can always share your personal opinion on a bill, and you can always share how the bill will impact the systems you work in or where you live. So it's totally fine for me to go and say, I support Senate Bill 273 because I know a lot of firearms owners that could really benefit from having access to safe storage. When it becomes lobbying is if I say, Representative so and so, I want you to vote yes on this bill, or I want you to vote no on this bill. Here's why. So long as you don't tell them how to vote and you just tell them how it might impact your life or your community, you can always have those conversations. You can talk about specific bills. You just can't ask them to act in any way on that bill.
Yeah, and the other, what I would share with legislators, share what is going on in their community. That's what they care about. So if there are numbers that that you're seeing, whether from a coroner's office, uh, or if there are increases, decreases, here's what's going on. Don't just share the bad news. Share the good news that's happening too. Hey, here, we're working with the school and we've seen this type of this type of outcome. Those are things that every day you should be sharing. It's not only could you should be sharing that because going back to you are the one who is the expert in the community on suicide prevention, and not to be too I guess crass, but act like one. That be the person that they will regularly reach out to, and again, sharing information and educating folks is advocacy and not does not cross any line of lobbying any day of the week. So sharing information, sharing numbers, sharing outcomes, sharing strategies, they want to know that and they want to hear that because they want to see what the dollars that they fund through the budget, which is going to happen, in whatever it is, 11 months from now, and discussions are going to be in 7 months. Those are things that they need to hear um, before um, before you get to the fancy. I'm going to stand up in front of this committee and talk about whatever suicide prevention. So have those conversations now. You can share all of those numbers, share all of the information, And again, they're back in the district now. They're not down here. So get with your folks, get with your legislators in your district, and talk about the important work that you're doing. Make sure that you are the expert and somebody else isn't. So that's what I got to say on that.
Thank you, Tony. We are at time, so I wanted to thank everyone for submitting your questions. Our next advocacy update is going to be on Tuesday, August 11th at 10:30. So if you'd like to join us, feel free to scan that QR code. I'll also be sending out a recap email afterward with the link to register. I'm going to include the link of how the Kids Act passed through the House. That was a question that came through that Daniel answered. So you'll have a link to that, as well as a link to the slides so that you will be equipped to talk with your legislators in the upcoming month. Thank you all so much for joining us today, and we look forward to seeing you next time.